Today, the third topic in our series of 10 musculoskeletal conditions that personal trainers should not miss or should be aware of, we're talking about a condition called Spondylolisthesis. Spondylolisthesis in most people, about 5 to 10% of the population, are born with genetic stress fractures or defects in the pars articularis part of their lower back. So effectively, if you think of it as that the front of the vertebra, because of two defects, is not connected properly to the posterior elements, particularly the spinous process and the lamina. So what happens is that when you look at vertebra on an x-ray, instead of sitting on top of each other, one vertebra is physically slipped forward relative to the one below. So we call that a spondylolisthesis. And effectively that level of the spine is then already in extension or back bending even when the person is just standing normally. So generally people with spondylolisthesis won't like sustained or repeated extension like cobra stretch in yoga, so you need to be careful with how they load into extension, but they do need some stabilizing or strengthening work, particularly for the abdominals and the gluteals, to try and get that control of extension. They're often stiff in their thoracic spine and need some thoracic mobility, and also in their hips. You can also develop, there are other types, you can develop a spondylolisthesis. Fast bowlers in cricket, if they're a right-hand fast bowler, will often develop a pars defect or a stress fracture on the left side, and also we do see degenerative spondylolisthesis as well. So Google spondylolisthesis and have a chat with a physio if you have a client that presents with spondylolisthesis, so they can give you some specific tips and advice on what you can do with those people. That's it for this week, guys, and we'll be on to topic 4 next week.